This week, U.S. Senator Tom Udall addressed a joint session of the New Mexico legislature. He talked about how a repeal of the Affordable Care Act could affect our state. And Mr. Udall and other health leaders fear that if the act is in fact repealed with no or an insufficient replacement, more than 360,000 New Mexicans who have gained health insurance through the ACA or Medicaid expansion could stand to lose it. Also, if hundreds of thousands of New Mexicans with pre-existing conditions or with high medical needs could see a drastic change in their health insurance, we wanted to shed some light on what this all means for everyday New Mexicans. I'm joined today by Linda Wadeen, Interim CEO of Be Well NM, New Mexico's health insurance exchange; Roxanne Spruth Bly, she's an independent consultant with Bly and Associates, which helps people implement effective programs that improve the health and well-being of Native people; and Gabriel Sanchez, he's executive director of the Robert Wood Johnson Foundation Center for Health Policy at UNM, and he's also director of research for Latino Decisions. Now, Linda, thank you for being here. Really appreciate all of you being here, as a matter of fact. Let me start with you. Senator Udall also said that ACA repeal with no replacement could set New Mexicans back to the days of no care if this happens. And use of taxpayer-subsidized ER services as a last resort. Do you see that, in fact, happening as well?
Yes, I do.
Okay, why?
You know, one of the things that the ACA did for people was, A, make healthcare affordable, because they could get actual healthcare with subsidies from the federal government.
Right.
It also expanded Medicaid, so that we had more people eligible for Medicaid that couldn't even afford to get healthcare with subsidies.
Right.
That allowed people then to be able to have healthcare, to go into whether it was practitioners, doctors, hospitals care, and that the hospitals would be compensated for treating those people.
Right.
What happens now is if that all goes away, hospitals are probably still going to treat somebody if they come in emergency care, but they're not going to be compensated. So that puts a huge burden on New Mexicans, hospitals, all the ancillary services around the hospitals, the practitioners, the labs, et cetera, that will be doing things and not getting compensated for it. But the biggest thing is that people will not get health care because they won't be able to afford or even think about going to the hospital if they get sick. That's a real concern to us. We've had a lot of people be able to get preventative care, which is free, so that we'd have a healthier community.
And that's particularly important for our state, the preventative stuff, isn't it?
Exactly,
Yeah.
exactly. Yeah.
Interesting. Gabe, good to see you again, as a matter of fact.
Always.
Let's talk about the bigger politics of this as well. Could you actually, in your mind's eye, actually seeing this, in fact, being flipped and replaced politically without a sufficient replacement? Could that, in fact, actually happen?
It doesn't look like it, at least quickly.
Yeah.
I mean, so immediately after the election, a lot of folks thought some of this would happen very quickly. The reality is, I think when President Trump noted that not only were they going to repeal this, but they were going to replace it with something that wouldn't cause any drops in insurance and actually would make this less costly.
Right.
That bar, I think, has a lot of Republican members of Congress very, very scared about this because the law is actually more popular than it was about a year and a half ago. And all these folks that have had insurance in states like New Mexico all of a sudden are going to be angry at somebody.
Right.
And where might they point that blame? So I think it's probably going to be at least a year, maybe 2 years out. I think I'll speak for all my colleagues that everything we have to say today is with a major, huge grain of salt.
Right.
Because the environment is changing by the day.
Exactly. Staying with you for a quick second, I referred to Senator Udall, of course. Part of the speech he made to the legislature, he laid out some numbers. We're talking a loss, and Linda made this point too, of $2.2 billion in federal Medicaid funding in 2019 and almost $27 billion between 2019 and 2028.
Scary numbers.
New Mexico could not handle that nut. So what do we need to do? Is it on our senators? Is it on us? I mean, how do we get into the game here?
Well, I mean, another scary thing that a lot of people are now starting to talk about is what about jobs?
Right.
Because I think the important context is New Mexico has seen the greatest increase in our insured population since 2013.
Right.
So we've benefited the most. So if you take it away, we're going to lose the most. And one number a lot of folks are throwing around, about 33,000 jobs will be lost if this is completely repealed.
No kidding.
It's almost 4% job loss. That'll be the greatest of any state in the United States if this actually happened.
Wow.
At a time where New Mexico desperately needs jobs. So I think that's the political environment in which all this is happening. What can we do? Obviously, we got to rely on our delegation, but I think it's up to the public to basically send signals that, hey, the ACA is working in New Mexico, and I think the recent increase that we've seen through Be Well, NM is a sign of that. I think people were worried. They're saying, look, symbolically, we want to engage, we want to be insured, and I think more of that is positive.
Exactly.
Interesting. Roxanne, thanks for being here as well.
Thank you.
Interesting. We have, of course, ramifications for the Native community with this situation. In general terms, what's your sense of what would happen for Native Americans here in New Mexico with repeal of Obamacare?
Well, there's two major effects. Obviously, the first is the effect to the individual. Right. Currently, we have more than 60% of the Native population on the Medicaid program, and nearly 40,000 are in this adult expansion category that's a central part of the Affordable Care Act. Okay. And so individuals losing coverage, especially in communities where people tend to be lower income, they have a higher incidence of disease, especially chronic disease, loss of insurance, and the peace of mind that comes with having insurance is catastrophic for families. I mean, they're not able to get the care they need. If they do need any kind of emergency care or specialty care that's not available through the Indian health system, they could be left with a significant amount of medical debt. So the effects on the individual are considerable. And then there's also the effect to the Indian health system itself, which for decades has been woefully underfunded at about 54% of the actual need. And Medicaid expansion and the increased numbers of Native Americans with health coverage has dramatically increased their third-party revenue, which has allowed that system to stabilize, strengthen, expand, and grow. The ability to hire more providers, to provide different services. You know, prior to ACA, a lot of Native people were relying on a program, now it's called Purchase Referred Care. And at that time, if they needed services outside of the Indian health system, those services were rarely paid for unless it was a life or death situation. So when I began my work, frequently I'd encounter elders who could not get approval for things like cataract surgery, things that are necessary and critical to good health and well-being. So repealing the act has significant effects for Native people as individuals, as communities, for the tribes, and for the Indian health system itself. Another component of it that people don't often recognize is that it permanently reauthorized the Indian Healthcare Improvement Act, which contains a number of provisions that allow for an array of services for Indian people and for tribes, and so that would significantly limit the ability of tribes to expand their systems.
Wow, that would be a problem. The other thing that interests me when it comes to Native Americans in our state, everybody, I want Linda to touch on this too, is mental health and addiction issues. Where does the ACA work? How does that intersect, and what would happen if the ACA went away?
Well, specifically having access to those types of services and coverage to pay for those services, because that's part of the plans and an included benefit. But again, that Indian Healthcare Improvement Act contains a provision that actually directs the Indian Health Service to establish integrated programs for behavioral health. So one of the interesting things about disease in many Native communities is it's sort of a trifecta. So you have a large number of individuals who are suffering from diabetes, substance abuse, and depression, which becomes sort of a vicious cycle in itself. And so the Act is very important in terms of providing an integrated approach to care and disease management that could really, over the long term, improve the health of Indian people.
I could imagine. And that's part of that peace of mind you were talking about as well, that chance to have something down the road turn more positive. Linda, pick up on that as well.
Well, one of the things I wanted to add is that one of the things that this New Mexico did was they enacted legislation which actually created the New Mexico Health Insurance Exchange. Right. And in part of that legislation, it also pointed out that we had to have a specific Native American program to pick up on the things that Roxanne was talking about, so that, you know, we see this as something that is not just for certain people in the state, it's for all, and we recognize that Native Americans is a huge part of our population, obviously. So again, it impacts the Native American community, impacts the other communities, and we try to work together to really get the word out and educate everyone the values of having these types of services. That without the exchange being there to do that, it leaves all these other little pockets of things to happen, and there's not a real coordinated effort. But our concern is that so many people just, it took us about, now this is our fourth open enrollment, it's taken us that many years to really get that message out to everyone in the state. We have a huge rural state. It's hard to get out there. It's
going to be a challenge,
It's a big challenge, but we've worked very hard, and we've worked with partners like the Native American groups that we've worked with and other partners, Hispanic partners, et cetera, so that we can get that information out through the state. If we're not there to do that, it'll be fragmented again.
That's right. I know nationally we're up a little bit on people signing up. Well, how did it turn out in New Mexico this cycle?
We ended up at just a little above what we did last year.
Okay.
But that's great. Since we started back in 2000, I think it was 12 or 13, the uninsured rate in New Mexico was about 23%. It is now down to 10%.
Wow.
That's a huge deduction.
Sure it is.
Best in the
So-
nation on that.
Is it really?
Yeah,
No
best
kidding.
in the nation. That's right. So that, but that's, that's indicative. But there's still a lot of uninsured people out there.
Well,
there,
good
and there
point.
are some people that just, we can work very hard and they won't get insured no matter what.
That's right.
That's what people
right.
do. But
That's right. Gabe, we hear a lot about block grants to the states
Yes.
to distribute this money. Could you explain that for the folks a little bit in brief? And then what does that mean for New Mexico if, in fact, that came to pass?
Yeah, I mean, really quickly on the inequality issue. Most folks don't realize this. Pre-ACA, New Mexico had the greatest inequality by race and access to insurance. So we got to keep that in mind when we're talking about the Native American communities, Hispanic communities. ACA plus, the governor's very wise decision to expand Medicaid had really shrunk those inequalities. But our colleagues at the Urban Institute say if this was to be repealed, the Native American uninsured rate would triple, just like that. So I think that's the important context on race inequality. Block grants are another incredibly complex situation that a lot of folks here, by the way, were already thinking about at the state legislature before the election of Donald Trump and the discussion about repeal, largely because a lot of the funding that comes from the federal government, it's like a decreasing pyramid, right? Over time, their subsidies decrease and the state has to pick up more of the overall costs. And so we were already on the train of trying to figure out at a time where the state's budget is so tight, could we afford that? And the block grants are incredibly important, particularly for rural areas that can utilize those funding to expand access. And in many cases, one of the things that's most scary on the marketplace side is all the funding that's provided for the federal government for outreach, to find these folks, educate them, bring them into the system. If that goes away,
Right.
you would know better than I, but I suspect that's going to be hugely problematic for capturing the rest of that population that's uninsured.
That makes sense. Roxanne, pick up on that as well. The idea that on one side of the argument, if folks, Gabe makes a point there, you can have more local control, for lack of a better term, versus the system we have now. Do you see it as one way better than the other? Is the block grant a problem for you, or how does it work?
I see it as a definite problem
Okay.
because I think it's framed and messaged as an opportunity for states to have more autonomy over their Medicaid programs or more latitude. But because it's a fixed amount of money, if you don't have enough money to provide all of the benefits or cover all the benefits you've been offering and all the individuals on the program, it does give states more autonomy in terms of where they start cutting. Because currently there's standards in terms of eligibility, in terms of the benefits and so forth. But if they have a significant amount of latitude, they could begin cutting things that are critical to the well-being of the people that are on the program. And that's the danger. In addition, the fixed budget,
Right.
that's a problem. Currently the program can expand if there's more people on it or constrict, especially, economic downturns, more people tend to be on Medicaid. And so having it fixed with that caveat of the latitude, it could be a very unfortunate situation for New Mexico.
I agree 100% with what Roxanne is saying. The other thing with the block grants is it goes into the general fund. It doesn't,
Key point.
and what happened with, especially what's happening now, where they're trying to look at places to cut back because of the huge budget deficit in the state right now. That would be probably one of the first places that they would look.
Right.
And they could move that money somewhere else.
Right.
So the grant doesn't necessarily get committed to, what it initially intended to do.
Right.
So that would be a huge concern.
The worst timing possible, right?
Worst
given where
timing
we're at in the
possible,
economy here in
yep.
the States.
Right. Let's assume if there's not just a whole cloth replacement, that folks sort of tinker with it as it goes along. One of the things that folks talk about that is gone now is the lifetime cap in pre-existing conditions and things like that. Is it a case, am I thinking correctly, thinking if one piece gets plucked, the whole thing sort of unravels? Do we need to have this completely whole as it stands now, or can we go to a roll back certain things?
Oh, I think that there's lots of opportunity to, quote, repair it, as
Okay.
they say. I
Okay.
mean, it's the first time it ever happened. It was new. It was brand new. I think there's been a lot of things learned. But yes, I think there's places that things can be improved on. But the worry is that they will pluck it, as you said. Yeah, plucking is different than improving.
Gotcha.
So, I think there's places that things can be changed, but there's some really key things that need to remain, and that is certainly it's the pre-existing conditions, preventative care, which is huge. A lot of the other programs, that if they start pulling those out, it will unravel. It will totally unravel, and you'll see a lot of people over 30 million people in the nation have insurance now because of the ACA.
Right. Right.
That a lot of that'll go away.
Interesting. We're going to wrap up here. Gabe, let's finish up with, if let's assume New Mexico, we clear this, the ACA stays. Do we build on this? Can we take this, what we have, this foundation, like you're mentioning how we've got a lot of folks now with coverage before. Is this our catapult forward to something better in New Mexico if it stays intact?
It absolutely can be.
Yeah.
I mean, I agree completely. I mean, the thing about this is it's not a black or white issue.
Right.
Kill it, keep it. I think both sides of the aisle understand that, hey, there could be some important remedies done here, primarily on cost.
Okay.
Our center just did a massive survey of New Mexicans asking them about a bunch of health care issues. And even among the folks that are insured, they still say cost is a #1 obstacle for them to receive care, particularly preventative. That's even higher among those who are uninsured. 67%
Wow.
of the uninsured say they've skipped seeing a doctor because of the cost. So I think we can still work on this, but we're seeing it's coming at a time where New Mexico desperately needs those jobs, the federal funding that comes along with it. I think most folks agree, let's use this as a building block. Maybe mend it, but don't end it, right? We're coming back to that language, and I think in New Mexico, more so than anywhere else in the country, it's critical for us right now.
Thank you for making that point. It is about somehow we are different here. We have different needs, and we have to, attend to that. Thank you all for being here. Really
Thank you.
appreciate it.
Thank you.
Appreciate it.
Thank you.
You got it. I'm Gene Grant. Thanks for joining us for New Mexico in Focus. We appreciate your time and effort to stay informed and engaged. We'll see you next week in Focus.
Funding for New Mexico in Focus provided by the McCune Charitable Foundation and the Nalita E. Walker Fund for KNME-TV, the KNME-TV Endowment Fund, and viewers like you.